But first, down to the wire on health care reform. The House votes just hours from now. President Obama made a last-minute trip to the Hill yesterday afternoon for the final push. Joining us now, two men at the center of that fight. House Republican Leader John Boehner of Ohio and House Democratic Leader Steny Hoyer of Maryland. Both of you, welcome back to Meet the Press on a big day.
Good to be with you, David.
Leader Hoyer,
nice to see you.
216 votes. Where are you this morning?
We're going to get those 216 votes because we believe that they understand that Americans want health care reform by overwhelming majorities.
Do you have them as we sit here?
I think we're going to have 216 votes when the roll is called, yes.
But not yet. You're not nailed down. You're still a few behind.
There's still members looking at it and trying to make up their minds, but we think that they're going to be 216 plus votes when we call the roll.
What makes you so confident? What's the final push?
Because for 100 years, over 100 years, David, as you well know, presidents of both parties have been saying we need to make sure that all Americans have access to affordable health care. George Bush said that. His father said that. Richard Nixon said it in 1974. So that this is the time to do it. We've come the furthest we've ever come to getting this done, and we're going to get it done today in the House of Representatives.
Fair to say there will not be a vote called if you don't have the 216?
We're going to have a vote. We're going to have 216.
Either way.
We're going to pass this bill.
Either way, you'll have a vote?
We're going to pass this bill, David.
Leader Boehner, do they have the votes?
Well, it's clear from listening to Steny that they don't have the votes yet. You have to think about this. 54 speeches by the President of the United States over the last year. A year's conversation with the American people. And they've been heavily engaged in this conversation for 9 months. The Senate bill's been out there now for 3 months. And yet, after all of this hand-wringing, all of this debate, millions of Americans upset on both sides of this debate, we're about to make this historic change on a purely partisan vote. And I think if the American people stay engaged in this fight for the next few hours, that this fight is not lost yet. This fight for having real health care reform on a step-by-step basis to make our current system work better really can happen. But first, we have to stop this bill, which will ruin our economy, ruin our health care system, the best health care system in the world.
All right, you'll be able to respond to some of the substance of that. But I thought Rex Babin in the Sacramento Bee, a cartoonist, summed up what the final push really looks like in this cartoon. You have Speaker Pelosi, or the Rough Rider, trying to herd cats, literally, in the Democratic caucus. To Leader Boehner's point, why is this vote so close? Does it have something to do with the fact that if you look at the opinion surveys, the public's against it?
No, I don't think that's right. The Economist poll shows that the majority of Americans are for it. Kaiser shows that Americans are for it. Wall Street Journal poll that came out just a few days ago shows
that's our poll. That's not what it shows. It shows a majority want them to complete it, but the majority are opposed to it.
Well, I think if you look at every one of the internals, David, about stopping insurance companies from preventing pre-existing conditions from getting insurance, from putting so much money on you have to spend per year that you go bankrupt, and not putting on lifetime caps. Those insurance reforms, those process reforms to insurance companies that are hurting Americans are all supported by overwhelming numbers of people.
Well, Steny, listen,
and people believe that we ought to have national exchanges so that the free market can be operate, so you can have transparency and competition. Let me also say about this vote, David, you remember the prescription drug bill? You remember that it took them 3 hours, from 3 a.m. in the morning to 6 a.m. In the morning, to bludgeon their members to get it to pass. And it was very controversial. And guess what? People like that prescription drug program. And in fact, we're going to make sure that the failures of that program to make sure all Americans could afford it, we're going to close the donut hole for seniors. So I think that Americans are for this bill. What they don't like is the divisiveness, the confrontation, and very frankly, the misrepresentation.
David, there are insurance reforms and health care reforms that we can't agree upon. We talked about it at the White House during the summer. But what the American people don't want is this big government takeover of our health care system. 160 new boards, commissions, mandates, $500 billion in tax increases on an economy that is supposed to be producing jobs, and $500 billion being stolen from Medicare in order to fund a new government entitlement program. They want no part of this.
Let me interject a question.
Stolen. John, you know that is not true. This is not a government takeover. It's a creation of open markets with private insurance companies offering insurance to people who don't have it.
It is a government takeover. And a mandate on every American to have health insurance, a mandate on every employer to provide health insurance. How about the health choices czar that's going to decide what every health insurance policy in America looks like within 5 years?
Let me interject a question about the tone of this debate. This was the scene on Capitol Hill yesterday where you had Tea Party activists protesting the vote, and in some cases it got quite ugly, where we had instances of epithets being hurled at Congressman Frank, racist epithets as well hurled by protesters. Are you concerned, Leader Boehner, that the Republican Party is in any way associated with Tea Party activists who are among these protesters?
Well, listen, there were some isolated incidents on the Hill yesterday that were reprehensible and should not have happened. But let's not let a few isolated incidents get in the way of the fact that millions of Americans are scared to death. And millions of Americans want no part of this growing size of government here in Washington. We've got the best healthcare system in the world, and we're about to take this dangerous step, very dangerous step, toward the government running the whole thing. That's not what the American people want.
We've heard this debate over weeks and months, and we're not going to solve that now. This is very much a question about the role of government in a system like healthcare. But I want to ask, first of all, Leader Hoyer, a comment on some of the protests that you saw yesterday and the tone of the debate at the end.
I think the tone of this entire debate has been denigrated, has been brought down, frankly, by the rhetoric of government takeover, socialism, things that are simply not accurate or true. But it has put people in fear. And when they're fearful and angry, they don't look at the substance. But when you ask them questions about the substance of these bills, which is the point I made earlier, David, they say, yes, that makes sense. That's common sense. Yes, that makes sense. Whether it's the insurance reforms, the affordability, this is the biggest deficit reduction bill that we're going to have the opportunity to vote on in a very long period of time. And very frankly, John Boehner said in 1993 that if we adopted President Clinton's economic program, the economy was going to go downhill very, very quickly. Unemployment would rocket up, and the deficits would explode. Exactly the opposite happened.
All right,
best economy we've had in my lifetime.
This debate will play out, but Leader Hoyer, I want to get to a couple of substantive points.
Yeah.
Very briefly, 3 top things that Americans will feel from health care reform this year.
Availability of insurance, availability for small businesses, for seniors, the donut holes are going to be closed. People who have children who are up to 25 or 26 years of age will have access to be on their insurance policies. Immediate reduction in prices for small business. They're going to have group availability of group policies and tax credits for small businesses and individuals to get insurance.
But the 32 million additional don't really start to get covered until 2014.
We'll phase them in. That's accurate, David. And we're going to phase them in because this is a very large, complex program.
You're right. Most of this doesn't go into effect for 4 years.
Well, he's correct.
Except the tax increases and the Medicare cuts go into effect immediately. So we've got 10 years of Medicare cuts, 10 years of tax increases to pay for 6 years of this new program. And while
John, you make
my friend says
but we save over $1 trillion over the next 20 years,
that we're going to save money from this is just not true.
And
the $300 billion to fix the doctor reimbursement problem is not in the bill. And everybody knows.
In your bill,
and
John.
Everybody knows that it's going to be dealt with.
Why didn't you put it in your bill, John?
They take $70 billion out of the CLASS Act. This is the new long-term care insurance program, and they use it to pay for current benefits. And the $500 billion they take out of Medicare, they're stealing from Medicare to start a new entitlement program. And if there's savings from Medicare, why wouldn't we roll it back in to save Medicare and to prolong the trust fund that's there to fund
Leader
it?
Boehner, there's a question of the cost of inaction, and Ron Brownstein writes about it in his National Journal column. I want to put it up on the screen and have you react to it. In all, he writes, CBO, the Congressional Budget Office, has projected that the Senate bill would raise enough revenue and sufficiently cut existing spending, cover its cost, and reduce the federal deficit in the near and long term. For fiscal hawks, that's a powerful incentive for action. But equally compelling could be the price of inaction. If Obama's plan fails, as President Clinton's did, it's likely that no president would attempt to seriously expand coverage for many years. The independent Medicare actuary has projected that under current trends, the number of uninsured will increase by 10 million to about 57 million by 2019. Providing uncompensated care to so many uninsured people would further strain physicians and hospitals and inflate premiums as those providers shift costs to their insured patients. Why, based on that, would you not conclude that even a flawed bill, as you might see it, is still better than nothing?
I don't disagree with Ron wrote there. And there's nobody in Washington talking about inaction. We've laid out common sense steps that will lower the cost of health insurance, according to the Congressional Budget Office, by up to 10%. And this step-by-step approach preserves the greatest health care system in the world. It doesn't take this dangerous step toward government-run health insurance. And so we can take steps, and we need to take steps, but we need to do it together. Never in the history of our country have we made such a big, momentous decision on a straight party line vote.
Well, we made a very big, momentous decision in 1993, as I pointed out, on a partisan line. No Republicans voting for it. We had the best economy result in our lifetimes. However, having said that, the dangerous takeovers, this language really distracts us from the debate on the substance. Harry and Louise said in 1994, you're going to pay more and get less if we do something. We did nothing, and guess what happened? They paid more and they got less.
But
he's absolutely right when he makes that quote. This is an opportunity both to save money in the short term and in the long term. And unlike your program, which included 3 million people, this includes 32 million people.
But the reality is, this assumes the Congress will do what it says it will do going forward. And you know there is indeed the chance that some of the financing, raising taxes down the line, which won't happen until 2018, may not actually come to pass. So you can't take these CBO numbers to the bank, can you?
David, you're correct on that. And the Congress is going to have to show courage, and the American people are going to have to show judgment as we go forward. Whatever we do, you're absolutely right on that. As somebody who believes that the fiscal posture confronting our country is one of the most serious that we have, and we need to get back to fiscal discipline, fiscal balance, and the surpluses that we had during the Clinton administration. You're absolutely right on that. We're going to have to show courage and do what we say.
Leader Boehner, this is what you said about the politics of this decision for the November race. This is what you said the other day.
The American people do not want any part of this. And if anyone thinks the American people are going to forget this vote, just watch.
That, to me, I may be wrong about this, that does sound like a threat. Are Democrats going to lose the House in the fall because of this vote?
I don't know whether they will or not. Our goal is to gain the majority. It's a steep climb. But we want the majority not for the sake of having the majority. We want the majority so that we can renew our fight for a smaller, less costly, and more accountable government.
But the campaign in the fall will be about, for Republicans, will be about repealing health care?
If this bill passes, we will have an effort to repeal the bill, and we'll do it the same way that we approached health care on a step-by-step basis. I'd have a bill on the floor, the first thing out, to eliminate the Medicare cuts, eliminate the tax increases, eliminate the mandate that every American has to buy health insurance, and the employer mandate that's going to kill jobs.
They would cover far fewer people. I mean, that's the vision of the Republicans.
Would you eliminate
Leader Hoyer, wait a minute.
Plan will bankrupt our country, David.
That's not what the
Leader Hoyer, the
says.
Impact on 2010. Does this cost Democrats the House?
No, I think we're going to win the House back. I think the American public saw Republican leadership for 12 years, and they decided they didn't like that in 06, and they decided they didn't like the Republican presidency either in 08, and so they changed course. And they asked us to do strong things. And John McCain in that campaign said, what do we need? We need to have Americans have access to affordable health care. All Americans. That's what John McCain said in the debate in 08.
And I agree with it.
Obama said the same thing, and that's what we're doing.
We are out of time, Leader Hoyer. How many votes shy are you as you sit here?
We're going to get the votes.
Low single digits?
We're going to get the votes. Low single digits, certainly, but we're going to get the votes, and we're going to have those votes this afternoon.
All right. Trying to pin you down. Thank you both very much.